Hi everyone, this is Dr. Alexandru Zaru. I'm giving you this capsule from the West Island Metabolic Unit where I decided to present on Liraglutide. It's a molecule, but it's a molecule that we can find in two products, Victoza and Saxenda. Victoza for diabetics, Saxenda for weight management, chronic weight management, okay? And the reason why I wanted to talk to you about liraglutide as a molecule is because it is an injectable. It's not insulin, but it is an injectable. And it comes in two different pens. The Victoza pen, okay, for the diabetics with the medication already pre-filled, or the Saxenda pen that comes for the weight management patients, pre-filled already, and same idea for the dosing. It's all about twisting the dose adjuster right here to find your dose, and you're gonna know which dose you administered yourself. Who decides the dose? You start off with the healthcare professional guiding you through the dosing process of the Saxenda and the Victoza, but then you adjust depending on your tolerance to the medication. Now, I'm going to show you using the Saxenda pen how to administer and how to prep the pen, okay? You have to remember that these two pens, they use the same type of needles, okay? There's different companies that produce the needles. In this case, I'm going to be using the NovoFine Plus needles, 4 millimeter long, okay? So they come like this with a little paper cover up. So we remove the paper cover and we get ready for our pen to be screwed in. Once screwed in, we remove the first plastic cover and then we remove the second plastic cover. This is the needle. Now in this case, as you can see, there's already a droplet at the tip of the needle. Well, it kind of suggests to us that the needle has no air in it, that it's already the product that's leaking from the top of the needle. Well, we're gonna make sure. And how do we make sure? Is by purging the needle. How do we purge the needle? Is by looking at the dose adjuster here and making sure that we spin it, or we kind of choose the dosing of the main line with the 3 points at the end. Why? Because this is how we're going to make sure that there is no air in the needle. We're going to press it, and what we want is we want that needle, that little droplet, to either get bigger or to have more droplets associated with it. Look at this. Oh, so this one was really well purged. Okay, so it's ready to be dosed. The doctor gave you a certain dose of Saxenda or Victoza. Usually we start off with 0.6, okay? And then we choose our site. There's 3 main sites that we can administer Victoza and Saxenda. Either the back of the arm, the abdomen, or the legs. Now, in regards to the more popular site, it's usually the abdomen. It's between 3 and 10 centimeters from the belly button. Can be a little bit further apart, but that's the going radius of the injections. Make sure never to inject all the time in the same place because it causes trauma, okay? And what we do is we choose our dose and then we choose our site. In this case, the abdomen. So we make sure that there is a skin fold that we're grasping. Why? Because we want to administer the dose of the medication under the skin, not in the muscle. So we use a alcohol swab, we clean the area, and then we take our Saxenda pen or Victoza pen. We make sure to grab a skin fold, okay? And we inject the material. So we penetrate the needle very slowly into the skin, and then we press the purple button. Once the purple button is pressed long enough, the dial comes back to 0 milligrams, and that's when we count 6 seconds. 1, 2, 3, 4, 5, 6. Why? We want to make sure that all the medication was properly administered. We retract the needle, the pen, and we make sure to dispose of the needle properly. How do we do that? Remember those 2 plastic covers that I showed you for the needle? Well, the small one is used to cover the needle, and the big one, I use it to unscrew the needle. Once the needle properly unscrewed, we dispose of it in a sharps container. The pen now can be closed and stored in the fridge until the next dose. And usually these 2 medications are given on a daily basis, so you can actually store it in the fridge until the next dose the next day.